Well, uh, welcome back, animal lovers, to Awakening with Your Animal Family. I'm your host, Dr. Alan Schoen, and boy, has life changed since the last time we talked just a week ago. So many things are unfolding, and always in my goal to educate and empower animal lovers what you can do to keep your animals as healthy and happy as possible. Today, we're bringing on something that you can be doing at home. And when you can't get your animal to your veterinarian or to an emergency clinic or anything. Hey, so we have two really special guests today. One is Mark Strong, who I've had on before when he was explaining to you the latest in low-level light therapy, super class 1, super safe, super pulsed laser therapy, and how you can use that to help your animals heal. And Mark has a whole episode on this that you can go back to learn even more about all the details of the benefits of light therapy and laser therapy for your animals. But today, I'm bringing back Mark because he has a special program called the My Pet Laser Program, where you can actually use these lasers at home if you can't bring your animals in to be helped at your veterinarian. And your veterinarian can check at multi-radiance. Mark will explain all of that to you about how we can use the My Pet Laser at home. And then we have a really special guest that I'm just so grateful to her, Denise DeFollow. Am I pronouncing your name right, Denise? Yeah, that her and her dear 2-year-old dachshund, Pickles, who is a living example of how these lasers can help you at home right now when you can't get to your veterinarian or it's difficult to get to them. We thought that this would be so appropriate because Denise is a living, shining example of the human-animal bond, of the heart connection between our animal family, our animal friends, and ourselves. And so there's that. And then that her dog went through surgery, and then, gosh, she can't get her dog back to the veterinarian because of this coronavirus crisis. And there's so many things that I said, okay, I'm going to change all my plans and bring Mark and Denise on to share their story, because this is something that's directly relevant and beneficial to each and every one of you. And again, that's my goal. So I'll introduce Mark first. Mark, and you can see all of this on my website, but Mark is the head of both human and veterinary development for Multi-Radiance Medical. And they have a number of great, again, class 1 nanopulse, super pulse, super safe lasers, all different scales, but they have one specifically that is so safe you can use it at home. And so there's Mark, and then there's Denise. And Denise, I just met, and I'm just so blown away and impressed with Denise's background. Denise is an Emmy Award-winning CBS journalist for over 30 years. And she's just passionate about everything to help the planet. She has programs, I have to look it up. Well, I'll have her explain it. The Make-A-Wish program, foundation, and these other programs. And she's written a children's book on bullying and stuff. And she's making such a difference in the world that I was so excited to have her on Awake TV, because that's what Awake TV is all about. It's about elevating the vibration of humanity. And boy, can it use a little elevation right now. And so between Mark bringing his light to the show and Denise sharing her wisdom and insights from her place of coming from compassion and love, I'd like to welcome both of you to the show.
Thank you very much.
Yeah.
Thank you. Thank you, Dr. Schoen.
So I'd like to start with Mark. Mark, if you can just give a quick synopsis of everything you talked about for a whole hour, and you could talk about for endless hours because I don't know anyone who knows more about lasers than Mark. But if you could just give a synopsis of how multi-radiance and your low-level class 1 super pulse, super safe lasers can be a benefit in these crises, in this time of crisis at home. And then how you and Denise connected. And then I really want to give a lot of the show over tonight to Denise because her story with pickles is just so amazing. I just wanted to listen to Denise. So, and she really has done such research. She knows more about intervertebral disc disease than any client I've ever met. You know, and I've been working with intervertebral disc disease and using acupuncture and rehabilitation since 1982. I've been doing it. And with the absolute worst cases that everyone at Animal Medical Center gave up on, where they said they have no deep pain, there's no way it's going to work. And then after a series of treatments, the dog is running around and wagging its tail. And they went, oh my God, there might really be something to acupuncture. And then all the other therapies that I've integrated since then. But I'll have Denise explain her more personal journey because that's what really touches our heart is when we see the one-on-one of it. So let's start with Mark. Mark, if you can just give us a quick synopsis of how the class 1 super pulse lasers work at home for this particular condition, and then also in general, where our viewers might say, geez, I'd like to find out how I could get this, how my veterinarian could get this, so I could be using it at home when I can't get in there. So take it away, Mark.
Thank you very much. You know, there's a very easy, quick analogy here too. This technology was designed and developed for people that were going to be up in space in capsules. And it's not too far afield from what we're having to go through today with COVID, where we're all in isolation. So they were having a hard time helping these astronauts and cosmonauts heal in space, and found that those that were working with lights to grow plants were actually healing. And this was a real revelation because normally cuts and abrasions don't heal in space. And so this led to the development of very synergistic, specific wavelengths and specific frequencies that would come through the skin and stimulate the mitochondria, the energy factory in our cells. And so these light photons stimulated the mitochondria, produced more ATP, and ATP is our cellular fuel. And they did it without any side effects once they shortened the pulse durations to nanoseconds. So by changing that semiconductor, we went from a continuous beam, which is a class 4, which can be very hazardous and burn, to an extremely safe super pulsed laser that's putting out much more high density photons into the tissues where we need them, into those target tissues, to accomplish these benefits of making more cellular fuel and improving blood flow. And this is what's led to a way to accelerate recovery of surgery from injuries, or rehabilitation, and all these wonderful things. So in the 10 years now that I've been with the company, I've literally seen hundreds of examples of lameness with their necessity for regenerating nerves, which has now led to these animals being able to recover because they've grown this nerve back to the end of that extremity. And now the nerves are firing with the nerve impulses to the muscles and making these muscles work again. So lameness has been a big area of our work. We've now done more peer-reviewed studies than any other laser manufacturer out there, but we've also reduced the form factor to something that's very portable. And Denise will be showing that in just a couple of minutes here. It's now battery operated. It now can be taken into a home. It can be prescribed by your veterinarian or your medical doctor for all sorts of conditions, but it boils down to 3 specific areas: pain management, reducing inflammation, and especially accelerating wound healing. This is a really big deal for us because, you know, we're in a world where surgery and drugs are taught in medical school, but there are other things with a lot of evidence behind them that have been proven to work very, very effectively. So that's what laser therapy is all about, or more correctly called photobiomodulation, the stimulation of cellular metabolism to help us heal faster. And Denise DeFali is another one of those wonderful stories of somebody that, in this case, saw our work in Australia because the koalas over there and all the burns and all these other animals, 1 billion animals have been killed by these things, but so many more are now in hospitals trying to help them recover. And the laser has been very instrumental in fixing infections as well with this new blue wavelength that we have. So stimulating nerve regeneration is a big part of our research. And Denise saw this broadcast, got in touch with us, and we reached out to her and said, yes, we think we can probably do some wonderful good for your dog as we have for so many others. So I'm going to turn it over to Denise now because she can articulate this so well. And it's just another great example of what's possible with a technology that's now able to be prescribed for home use. And Pickles, the star of the show, Pickles was looking at me earlier today like, I need an agent. We're getting a lot of showtime here. I need an agent. So please, Denise
That's her.
Zafala, Channel 8 affiliate in Cleveland, please take it away and help our audience because this is really good news.
Yeah,
Thank
so
you, Mark.
Pickles at 2 years of age is becoming an influencer, eh?
Exactly.
She sure is. In fact, there's a very famous photographer here in Cleveland. I'm in the Cleveland area, and his name is Greg Murray. And he wrote this book called Peanut Butter Dogs. Well, he asked me one day for a picture of Pickles, and she blew up his Instagram account because she's so cute, and she was just really, really young then. And he got a picture of her. I wish I could show it to you, but I'll get it to you. Her basically dancing with her eyes closed, and he said, "Don't let it go to your head." So she is only two. I know, she's wonderful, and she is a dachshund in every sense of the word. I had never had a dachshund before, and I am delighted to say I think I will always have one now. They are very spirited. She is Miss Personality, and I call her Pickles the princess, really, because of course she's a princess, right? But unfortunately, she loved to jump on and off of furniture. And with that long back, I knew that was an issue, but you couldn't stop her. And one night, Friday the 13th of December, just this past December, she probably jumped off a chair just right. And within about a half an hour, I could tell something was wrong. But of course, I had never seen this intervertebral disc disease in a dog before. So I thought maybe her tummy was upset. I took her out back, and it was bedtime. We went to bed, and by morning, when I went to get her, she was sitting up and clearly in shock. Her back legs were lame. She looked like a seal. She couldn't move, and she was terrified, and we were terrified. I mean, all those thoughts go through your head. This is a 2-year-old dog. She's basically still a puppy to me. She is our son's dog, his first dog. And my immediate reaction was, I need to get her to the emergency clinic fast. So it's a driving rainstorm. There's no neurologist at my nearby clinic. I had to drive to Akron, the home of King James. And I found a MedVet clinic there, and they diagnosed her right away. And our option was surgery. She needed an MRI and then surgery, or the alternative was to put her down. And we discussed it as a family, and we decided to give her that chance. And the vet was very clear with us. She said, look, it's a 50-50 chance. There's no guarantee. But when I heard 50-50 chance, I said, my glass is half full. I'm going to take the 50 good part of that, and we're going to give it a go. So, of course, not knowing what all that entailed, Dr. Schoen, I have to express her bladder now. She can't pee on her own. There's so much involved. The crate period of time where, she can't be scooting around the house because she could get injured. You want to keep her back as still as possible. And as soon as it was good for us to get therapy, I reached out to our local therapy place that I wanted to visit, but because of Christmas time, I had to wait until after Christmas to come in. And we started immediately with laser therapy, and we started doing water treadmill once the wound was healed, and land therapy and all those things. But her disc was a very bad rupture in the lumbar section of her back, which is way towards the back. And I think it was about L1 or L2, right in that area. Part of the disc material went up and part of it went off to the side. So her left side and her right side are affected differently. As time went on, we did try acupuncture. And of course, the water therapy was very helpful, and the land therapy. But I noticed every time she had a laser, that was making a huge difference. Then I saw this story on Fox 8 News in Cleveland about the koala bears and this local company in our greater Cleveland area in Solon named Multi Radiance Medical. And that's where our home laser journey began. And as soon as we got this tiny little laser, look at the size of this thing. I mean, you can put it in your pocket and carry it to any room in the house. You could use it off, site if you needed to go on a day trip or something like that. You could take it with you. It's so portable and convenient. And now, thank God more than ever that we have this laser because of this coronavirus outbreak. Our veterinary rehab hospital is closed. There is no rehab. So without this at-home laser from Multi-Radiance Medical, our Pickles would be losing valuable weeks in her recovery period. When this happens, as you know, Dr. Schoen and Mark as well, when this happens, there's about a 6-month window where the dog at 6 months is where she's probably going to be. So time is of the essence. And I'm not losing valuable time at home because of the My Pet laser. We are able to continue this valuable laser therapy for our little girl. And the results have been amazing. We have seen her tail wag. I've seen the hair on the back of her neck rise when she's barking at a dog out the window walking by. She hadn't done that before. When she stands now, she stands for longer periods of time. At first, it was like a split second and she would fall down. Now she'll stand for about 7, 8 seconds, and you see the muscles in her leg trembling. She's trying to stand herself and she wants to go. So each and every week, we've seen progress since I got the My Pet laser. And I can't thank Multi-Radiance enough for developing this technology. And of course, it works for people too. And if you have aches and pains, this is the ideal thing for you to try at home as well. Right, Mark?
Yeah, absolutely. There are a lot of different conditions that are very effective for this. And the company was on the human side for 10 years before I got involved. And it's been a real boon for professional athletes because they're constantly in rehab. But there are so many different conditions that benefit by light. And it's the cells, and it's a natural process, and there are no side effects. So this is what's really kept me, well, I have had to say in the past, I'm addicted to this kind of a job because you see people improve like this, you see animals improve like this. And I've had the great joy to work with so many phenomenal vets around the world. We work on everything from hamsters to elephants. I've been working in Thailand with elephants over there with huge necrotic wounds and just all kinds of things. But to see examples like yours is so heartwarming because I know how much you love your dog and I know how much that dog loves you. And animals are part of that bond that we have that makes us all better people as a result. And so being able to help these animals just means the world to me. And Dr. Schoen, you've seen this in your 40 years of practice. It is such a joy when you find something that works repeatedly, has no side effects, has evidence behind it. That's what you look for, right?
That's my whole veterinary journey. Was my passion has always been to help the animals that didn't respond to anything else. And so it started with acupuncture, it went on to Chinese herbs, to Western herbal medicine, to chiropractic, to laser therapy. I've been using other lasers since 1982. But when I came across the multi-radiance laser in 2014, when I was lecturing at the world's largest veterinary conference, and then we met, and I said, oh my gosh, this one is a game changer. And I don't mean for this whole show to be a sales job for this, okay? We're doing this out of sincerity, saying, how can we help in the midst of this tremendous pandemic? How can we help animals and people heal at home? And that's why, Denise, I can't thank you enough for coming forward on how it's helping. And when I'm listening to the neurologic signs, it's actually quite encouraging because, as you had mentioned to me right before the show, the surgeon was saying that it's 50-50. Right now, there's no deep pain. And for years, once they said there was no deep pain, that really meant that's it. There really isn't any chance of recovery. And, you know, for me, that was also I would always say, boy, if there's no deep pain, the prognosis really isn't good. But then there were so many animals that I would dig deep into their toes and you would see a little bit of a reaction. So it was, I would say it's more questionable deep pain. And with that, we would do treatments and not all of them, but 80% of them improve dramatically, where they're able to live, wag the tail, run, develop urinary control, fecal control. And at some point, I'll share with you, there's actually some great acupressure that you can do at home. Okay, that's for dachshund on their toes and at the tip of their tail. There's one acupuncture point that we actually don't have in humans, because most of the points are actually extrapolated from humans to animals. When I first started teaching this, and then I was lecturing one time at Beijing vet school, and they said, we made these maps for dogs out of a joke for you Westerners. We never treated dogs really, and I had extrapolated these human acupuncture maps to the dogs, along with a few of my colleagues at the time. And so there's a point at the very tip of the tail that you can just pinch, and you see the tail wag more, and they don't like it. That's a point they're not particularly fond of, but it's thin enough that
it goes crazy.
Goes crazy.
Yeah.
And that actually sends a nerve impulse all the way up.
I don't know if I can do it. I can't do it now.
Oh, there you go. Yeah.
It's hard to hold her and do it, but it does go crazy, flopping around.
Yeah, and I have a friend here on the island where I live, where they have 15-year-old lab, the other side of the age category. And that dog had fecal incontinence and spondylosis and everything from arthritis in the back. And the laser, they ended up getting one because they couldn't live without it. And the dog loved it so much, the dog would go over and paw at them to use it on them. And then I showed them how to, they were saying, what about the fecal incontinence? And I said, well, try pinching the tip of the tail. That took care of the fecal incontinence, which Western medicine had no answer for.
Right.
So that's where I just love it. Brings me such joy, and why I've had such joy throughout my career of helping animals is when people would say there's nothing more we can do. That's where I came in and said, what else can we do?
Mm-hmm.
And having that attitude. And sometimes it didn't work and people understand, but everyone's so grateful, because instead of having this hopeless feeling of, oh my gosh, there's nothing we can do. I say, well, let's give it a try. I'm going to do everything I can. And that also stimulated me to always continue learning, which even now, even though I'm retired from active veterinary practice, I'm still exploring new techniques to bring in and help other veterinarians bring into their practices.
And Dr. Schoen, if I might, so I happen to be a Christian, and for me, the light represents the light from above, the light of God. So what I do is I pray over Pickles when she is receiving her laser therapy. And so you'll see the light flashing. I won't keep doing that, but I actually pray that that light is healing light. Of course, it is healing light. And that is the light from above, from a higher power, healing our little girl and giving her the ability to walk again. So, prayers, medicine, laser therapy, Western medicine, whatever works to get our little girl up and running again, that's what we want. And we're not giving up on her. Everybody who's had a dachshund who I have known or met through Facebook after this happened has said to me, don't give up. They'll come back. Don't give up. It doesn't happen overnight. You have to have the patience of Job. This is a long process. And believe me, caring for an injured dog this way over many, many months, imagine having to express the bladder of a dog every single day, 10 or more times a day. Sometimes she just has an accident right on me, and what can she do? She couldn't hold it. So it's taxing. I have bought multiple boxes of pee pads for when it's, the dead of winter. And when it's a really rainy morning like today, I said, okay, girl, let's get the pee pad, because I didn't want to put her out and get her all soaking wet and muddy outside. It's a labor of love, but she's worth it. And as you said, she is part of our family. There is that human-animal bond that Mark always talks about, and it's very special. She is a living creature, and we are trying everything we can to help her in her recovery. And I think it's coming. You know, I see those positive signs and I believe it's coming. I think that's half the battle. You know, you sometimes sense when you talk with a vet, they'll be like, oh, yeah, well, okay, good luck to you. And I just let that negative energy roll right off because I choose to believe that she will walk again and we're going to make it happen. And she is trying to make it happen. So as long as she's trying, I'm going to be right there beside her. And so is my husband and our son.
Oh, thank you so much. There's so much to share based on what you were just sharing. One thing I'd like to is with prayer, you know, what I love for over 20 years, I've been giving retreats for animal lovers and for veterinarians on the scientific basis of intention and belief. And there's so much research on the benefits, what it does to our brain. And
Sure.
you know, and what it does to our heart. And Heart Math talks about that too. And we've interviewed the scientists from Heart Math. So these, you know, what different spiritual traditions call prayer and this and that, these are real. And I love that we're at a time in human development where science and spirituality are coming together, where they've been divided for so long. And now they're coming together where when people talk about prayer, and I'm a big believer in prayer, don't get me wrong. Yeah, I'm like totally there. But when I start realizing that science is finally catching up to the spiritual beliefs and that there's a scientific basis to this, I thought that's really cool because veterinarians, colleagues who might not believe in that, here you're showing the science that, okay, here's a belief and here's the science, you know. And also going back to when you're talking about veterinarians rolling their eyes and saying, well, you can believe it, but it's not good, you know, and other, because I've dealt with that my whole career, okay? And, you know, sometimes people would say, oh, the animal should have been put down and euthanized. And then after 8, 10 acupuncture treatments, the dog's running around. And then they said, oh, spontaneous remission, you know? And I say, okay, call it another case of spontaneous remission after acupuncture. Call it whatever you want. But the bottom line is the animal's better. But some surgeons might say, well, the nerves, they regenerate at 1 millimeter a month. And that might have just been happening anyway. So question I have for you, where you're dealing with it every day, what have you seen? Because I know I can address that question, but I'd like for you to, from your perspective, when you use the laser, what do you see as, let's say a skeptic came up to you and said, who knows, maybe would have gotten better on their own, okay?
Right.
What do you see in your own hands every day?
Well, I'll explain what I see, and then I'll have Mark explain what's happening internally because he is great at that.
Yes.
So what I see is at first she looks up like, oh, what's that? And she looks back and she says, oh, I like that. And she gets very relaxed. She sometimes falls asleep. But what I've really noticed on a recurring basis, and you might be able to speak to the science of this as well, when those nerves are regenerating, she tends to feel something and start to almost nip at her chest. Like it's like something's on fire, something is firing internally there. And she loves it. When we bicycle her legs for exercise, she does that. When I use the laser, she does that. And there's certain spots that I hit that will prompt that reaction. So clearly, she loves the feeling of it. It's helping her. It's exciting. It's tingling. I think that's probably the best way to explain it. I've tried it on my knee for my patellar tendon, and it's tingly. And the next morning, I had no patellar tendon pain after about 8 years. So I can attest to the magic. But it stimulates, you can tell it's stimulating things internally, and she melts. A lot of times she falls asleep, she goes on her back, she's loving it. I mean, the girl is very happy when this is going on. Mark, do you want to talk about how it lights up the neurons in the spinal column? Because it's really fascinating, and I never knew anything about this until I learned about your laser.
Yeah, this is what is so really cool about it, because once they had the right wavelengths, then they had to figure out dosimetry. So it's one thing to validate that the right wavelengths are going to give you depth of penetration, and that's so key to get through the skin. And the red light is there because that's going to be absorbed superficially. And then the next wavelength is there to get through that skin. And then the next wavelength is there to facilitate getting the photons through the skin so you can reach those target tissues. But then it's, okay, well, how do you stimulate versus inhibit? So when you have somebody in pain, we want to inhibit that pain. So a higher frequency, we've developed a whole priority principle for this, so we know exactly how to treat the symptoms. But a higher dose delivered quickly is going to be inhibitory for that pain. But what you're seeing initially when we're doing something called our unwind protocol is you're getting an endorphin release, and this is what they're loving. Even cats who cannot tolerate class 4 lasers and have a hard time tolerating needles with acupuncture will still melt, as you called it, because it's that release of endorphins systemically that gives them that nice relaxed feeling. But then when we modulate the frequency and come down to slower frequencies and deliver the dose more slowly, this is what's going to stimulate the healing processes and upregulate that production of ATP and photodissociate that nitric oxide to give you a vasodilation, to open up those capillaries and allow more blood to come in, and oxygen and nutrients, and feeding these cells what they need. So it doesn't do anything with the healthy cells, but it does replace those cells that have been injured or those cells that need to be regenerated, especially for nerves, to speed up that process. So low dose delivered slowly to heal, high dose delivered fast to inhibit. And they've just figured out all the science behind this. So they call it the mechanisms of action. But for us in the real world, it's called giving you what works. And that's what's so beautiful about it. And because we're super pulsing it, we eliminated the heat. We never needed heat to get the beneficial effects. Photobiomodulation, by definition, is actually a non-thermal process. It's photochemical, photophysical. That's what made it safe enough for us to have vets be able to prescribe it for use at home and not worry about any liability, because you won't thermally overload the tissues. There are no other side effects. There's a couple of contraindications like pregnancy or cancer, but for all these other cases, it's very, very beneficial and with no side effects, which of course, at the end of the day, is what you're wanting to accomplish, not making you pay a price for the benefit. There's no price to be paid, you just get the benefit.
Great. Mark, thanks so much for explaining all the details of it. For the animal lovers, my viewers, so essentially in a case like Denise and Pickles, what it's doing, if I'm understanding you correctly, is it goes and it increases the microcirculation, it stimulates the DNA, stimulates the mitochondria in the cells, and helps then regenerate new cells. And where the nerves are regenerating at about 1 millimeter a month, what it's doing is it's helping the natural healing process, helping accelerate it. Because once they don't have deep pain, and what Denise was saying, why the most surgeons would give a very guarded prognosis at this time, and we had this narrow window, is because the nerves are just doing what they can. What the laser is doing is accelerating their ability to regenerate. So it's complementary, and not just complementary, but it's stimulatory to the whole process. And you do have this narrow window of time. Although Denise, when I heard you sharing what the different surgeons and veterinarians were saying, I always chuckle. And I remember one case that a veterinary neurologist referred to me, and it was a standard poodle that had a cervical disc, a disc in the neck, paralyzed instantly, just like your dog. It happened so quick. They rushed it to the surgeon. They said, this is too severe. You know, like, surgery isn't an option. Let's treat conventional with conventional medicine, all the steroids, the anti-inflammatories, everything they would normally do. Nothing helped. The dog could lift its head, but couldn't move its front legs, its hind legs. The client loved the dog so much, took care of the bladder, did everything, for 2 years.
Wow.
And somehow she heard about me and came to me, and I said, wow, no, the neurologist is right. 2 years. I mean, yes, it can lift its head and everything, but I've never treated one this bad, this long. I really, I would say, I said to her, I don't think I can help. And usually I don't say that, but I'd never seen one that bad. And I said, so she said to me, I understand. I get that from everyone. Could I ask you a favor? Could you just try?
Yeah.
I go, okay, I'm willing to try as long as you don't get upset if we go through. I usually ask for a commitment of 8 treatments of acupuncture to see if we don't get anything that you don't get upset. I'll do my best. And she goes, yeah, that's great. Well, we have it. I have it on slides. This is poor video and everything. This is a long time ago. And anyway, after the second treatment, the dog started using its front legs. On the 4th treatment, I have photographs. It was standing up on all 4 legs. By the 8th treatment, it was running and playing again. And that's after 2 years and multiple veterinarians saying, forget it. And me saying, forget it, And it was such a teaching for me about, wow, even when it's totally hopeless, based on what we know, that because of the love that that person had for their dog, and because of the neuroscience, neurophysiology of acupuncture, and again, my intention of giving it, all of us giving it all of our intention, our prayer, our beliefs, this dog recovered when it was totally unforgiving. That dog was really one of my greatest teachers, and in my books, Kindred Spirits and Love, Miracles, and Animal Healing, I always say some of my greatest teachers were my patients, and showing what I didn't think was possible. So I really want to support you in keep on going, because when you're talking about the tingling, what that is actually, there's a little stimulation in the nerves and you're feeling something, just like when your feet fall asleep, right? And then you feel this tingling, oh, okay, they're getting re-stimulated. And that's what's happening. But they're not sure what it is. But so it's this tingling. But that's actually, to me, quite encouraging. Okay, so I'm really excited. Keep on going. Okay, and
That's
we'll
good to
share
know.
with you, besides the tail point, I might as well just share it with the audience here too, is there are points at the base of each nail bed. Okay, so you find the base of each nail bed on the hind leg. And that's where the acupuncture points on the hind end, the acupuncture meridians, the pathways end, are at the base of the tail bed. So you can actually pinch those on each toe. Okay. And you pinch it till they start feeling something. They don't like it. And if they don't like it, that's great. You just have to watch your fingers that you don't get bit. Okay. But that in the front end, they feel, but on the back end is where you're not having the feeling. So it's like doing a form of acupuncture. It's acupressure, but at the base of the nail beds, the points are so close there that you can actually help them. Okay. And if you do that once, twice a day, and just go through all the hind, I'm showing on my hands, but not my hind legs, but doing it on the hind legs, and doing that a few times a day, you're actually able to do some acupuncture at home. So combined with that, with the laser and the bladder control, everything you're doing, you're helping, doing everything you can to help a living, energetic, loving body heal.
Thank
And
you
just
so
one more,
much.
and
Yes,
just
Mark.
just one more quick thing. The paper that you wrote a while back now, called the Liquid Crystalline Collagen Continuum. This was one of those bridge papers. We brought together the world of acupuncture and laser so succinctly, because you were pointing out that the collagen in our bodies is so transmissive to biophotons. So when you're putting a laser on one of these acupuncture points, that energy is going in and being transmitted through that collagen so efficiently into our bodies to get these systemic effects. This was one of the most important papers to help the Western mind understand what this Chinese traditional medicine is all about, translating it from fire, wood, and qi to anatomy and neural junctions and neural pathways and collagen and biophotons and transmission of this healing light into the energy of our bodies was such a pivotal paper. And so hats off, thank you very much for that, because you've bridged the world between the traditional, which is harder for the Western mind to fathom, and the anatomy basis, which says, okay, now I get it. I understand what's going on. This was a very important paper and helped a lot of vets overcome their skepticism to try things and then find out that they worked incredibly well.
Thank you, Mark. Yeah, that when I came across that research over 20 years ago, it's like literally a light bulb went on in my own mind saying the liquid crystalline collagen continuum theory explains all of acupuncture. It explains the traditional Chinese medical theories, all the debates on how it worked based on neuroscience and everything. It bridges and explains all of it. And what's really cool, as we're talking about the points on the hind leg, okay, at the toe, they actually did a functional MRI where they went and they inserted a needle into one point of the tip of the toe on the outside toe. And then they did the MRI and it showed that the area in the brain for the optic nerve actually lit up. Well, interestingly, for thousands of years in Chinese medicine, they talked about using that point to improve vision and improve sight. And here we actually have proof of that now. And
Yeah.
so again, it's science documenting, ancient traditions. And that's one of the amazing times about being alive right now in the midst of all these things, is the bridging of science and spirituality. And
Absolutely.
Mark, one question that I do have, because we're getting close, we have a little bit more time, but is if people are saying, oh my gosh, in this time of crisis with COVID and having to be home, and I want to get this for my dog, or I want to get it for myself or for both of us, because that's what I see is so many of people I know, they start using on their dog and they go, well, what about me? Just like what you were talking about, Denise, with your patella. And that's what happens. And then you start realizing, wow, I can use this to help all my family. So how do they go about finding out about it and connecting more with it? I mean, there's my website, and on my website, there's a link, it's drschoen.com, DRSCHOEN, and you can go to it. And I think, I haven't checked, I'm not good at this, but I think there's a link on that too, multi-radiance and everything. But let's say someone's veterinarian is not aware of it or is hesitant. What are your suggestions there?
Yeah, there are links on your website, but there's also, of course, our main site with multiradiance.com. And because we've had such an uptick in interest because of COVID, because of isolation, because of vets becoming more aware of it, we've now really added a lot more of the content that we've been accumulating from veterinarians over the last several years. So if you go to the veterinary section at multiradiance.com, you'll see a veterinary tab up there. And then go to the My Pet Laser, you'll see a whole series of videos. There are tutorial videos, there's testimonial videos, there's research there. But we also developed something else to make it a lot easier for vets. It's called myvetlaser.com. And we put the tutorials for exactly how to use it so that the vets, techs, or nurses could sit down with the clients at the practice once they have a diagnosis, which is why we're so loyal to the vet channel, because we want an accurate diagnosis to start with, so that they can look on the smartphone and see myvetlaser.com and see the tutorial, whether it's for pain or for a post-op or for infection or whatever it happens to be. The tutorial videos are right there, and they can see the research studies right there, and can see the testimonials right there. So it's all in one place, myvetlaser.com or our main website. Or they can just reach out to us at info@multiradiance.com. We have a very, very devoted team of people. Many of us have been with the company for many years now, because we are just so passionate about what we're able to do for people and for animals. So those resources are there. You can download studies. We have plenty of peer-reviewed, published studies, which is what vets respect most. But then for the pet owners, there's the tutorial videos where they can see just how easy it can be. It's just not complicated at all. We took all the mystery out of it. The nice thing about American ingenuity is we've made the electronics more compact. Because it's super pulsing, it doesn't use so much power. So the battery lasts for a week or two when you take it home. So it's just really, really simple to use so that you can get the benefits for your family. I don't know anybody that has purchased a laser for a pet and hasn't at some point done exactly what you said. Let me try this on my back or my neck or my knee. And of course, your husband tried it with his shin splints.
He certainly did. He is training for the Cleveland Marathon, which we hope might take place in May. Of course, that might be bumped back because of this outbreak. But he's been running long distances and he developed shin splints. And he said, oh my gosh, my shins are killing me. Let me try that laser. And so he tried it at night before bed and woke up with no pain. He said it was like magic. He was a believer. He's like, oh my gosh, my legs feel great. So it really does work. And, you know, it's great for nagging chronic conditions like plantar fasciitis. How many runners do you know, or ordinary people who just injure that spot on their foot somehow? And it lingers and lingers and lingers. And medicine just doesn't cut it. Of course, if you get the cortisone shot, it goes in, it doesn't stay locally where you need it, it disperses throughout your body. And what good is that? I tried something called iontophoresis, where they put the patch on your foot and then they run a little thing up your leg and there's another patch so you don't get an electric shock. That helped a little bit. But this laser, I mean, it's like, okay, gone. I mean, no, you don't even have to go to the doctor if you have this thing at home because it's so convenient and it works so well. I cannot tell you that knee was killing me for 8 years. It's a hereditary condition in my family. A lot of us have bad knees and there's 6 of us kids. And I mean to tell you, that thing really made a difference in my knee pain. And I feel it the second I step out of bed. I step out of bed. Before, every time I would get up in the morning, it would be killing me. And I wear a knee brace when I run and walk and things like that, and sometimes for yoga. But it's made a huge difference. So it's helping our furry friends and it's helping all of us.
And that's the beauty. Oh,
just one quick second. Truth be told, a lot of doctors have said to me, this is the most valuable modality in my practice. If I could only keep one thing, this would be it. I do more things with this, with no worries, no risks. This is the most valuable modality. We never say don't use this only, but they do tell us it's the most valuable modality in their practice because it works on so many things.
Yeah, and the beauty again is you can use it at home. Like you said, you can't, it isn't like you have to go to doctors. And these days it's hard to get there. And even before COVID, sometimes we're all so busy that you're trying to fit in a doctor's appointment or this or that. And if you can be doing it at home regularly, you're going to get better results because it's a regular treatment at home. But the important thing is also to say that ideally you need to do it, you know, what you need to do it through your veterinarian or through your doctor, and then they can guide you. And then, you know, if you contact Multi-Radiance, I would suggest tell them you've heard about this through Awake TV, through Awakening with Your Animal Family, and then they'll go, oh, you're part of that wonderful group of animal lovers, and they'll give you special attention. Okay.
And one last thing, I would be remiss if I left the cats out of the picture because I'm hearing the cats talking to me. Half the cats in the US are not getting vet care because it is such a traumatic experience. It's very traumatic for them to go into a carrier, to be in a carrier with these dogs sniffing around them and terrorizing them at the vet practice. So half of them aren't getting adequate vet care, or they have side effects with kidneys and liver issues with medications. I have watched so many cats that people said to me, oh, this cat can't tolerate laser because we tried it at the vet and it just didn't work out. And I said, give me just a minute with it. And I start doing the unwind protocol and the cat just melts like butter. It's enjoyable. They get the same endorphin release. And so we've had a lot of cats who are very happy as a result. You'll see those on our website as well. So I didn't want to leave out the cats because cats are left to suffer in silence many times because they're just not able to go, or they get the medication, they have side effects. But a very prominent vet said to me, the cat market will be bigger than the dog market because so many don't even get vet care. This is a huge answer for them.
Yeah, thank you, Mark. And thank you, Denise. Denise, do you have any other last words you'd like to share? Because when I was reading your resume, and people can go to your website. I mean, it's amazing all the wonderful things that you're doing to help children, to help animals, to help all people. And I can't thank you enough for taking time out of your busy schedule as a top CBS anchorwoman to share all of these insights and how happy you are. So are there any things you'd like to share as we're coming close to the end of the program?
Well, I know that you are all things holistic medicine, and I just wanted to stress again the importance of no side effects. This is, what I don't like to take a lot of medicine to begin with for myself. And I noticed after the surgery that Pickles had, some of the medicines were not pleasant for her to take. Some of them were people medicines that they tried to make in dog form, and they tasted awful, and she'd spit it out. And, of course, no animal loves you shoving pills down the back of their throat. And I love the fact that this laser has no side effects. It's not a medicine, and it cannot hurt her in any way. So that's what I really appreciate about it. I think that obviously there are times when you have to have medicine in the picture, but this is a wonderful tool post-op once the medicines are done. And it's great to be able to use this at home now more than ever because of this COVID-19 threat to all of us. So I appreciate it. I appreciate everything that you have done, Dr. Schoen, especially in teaching other veterinarians about the importance of acupuncture in Western medicine with regard to our pets. The Cleveland Clinic, the world-renowned Cleveland Clinic, is here. And many years ago, I did a story when they started their Center for Integrative Medicine. And they have known this for years. That place has been open for many, many years. And they offer acupuncture and all kinds of Reiki and everything else at many of their Cleveland Clinic sites. So it's, you just have to open your eyes and open your mind to the possibility that there are other therapies out there, and they can be just as effective, if not more.
Thank you so much, Dee. You're just bringing up memories of, I remember when the Cleveland Clinic for Integrated Medicine started, and I knew some of the doctors there who was starting, because way back when we were just a small group,
Right.
And so, and I love the interaction of human medicine and veterinary medicine is, as part being integrative. And like you said, we need Western medicine and surgery. Without surgery, your dog wouldn't have had any chance.
Exactly.
And this afterwards, it complements it. And that's to me, and my whole career has been about that integrative medicine. And I think these days with the crisis we're in, we need integrative, holistic approaches more now than ever, combined with the best of Western medicine. And I just want to thank you, Mark, for being on and sharing all your wisdom. And I really want to wish everyone out there, may you have the best health and best happiness possible going through this. And as Denise was talking about, at times like this, prayer is so important as well. Bringing an intention of love and light and being a benefit to all beings is so important. And with that, with the intention of this show, trying to be a benefit to all beings, we don't know, there are countless beings will benefit from this. So I really want to thank you, Denise, for sharing your story. And I really want to thank you, Mark, for sharing on the scientific basis of all of this. And I want to thank my audience. Go forth, be well. And till next week, when we're going to be sharing even more about other ways that we can be a benefit in these challenging times. So thank you all, and bless you all. Bye for now.
Thank you very much for doing this show. Thank you.
Thank you, Dr. Schoen. Thank you, Mark.
Yeah, thank you all.